Hey everybody, Ryan McMahon here to go over our COVID data today. We alluded to yesterday that today's going to be a busy day. It is 94 cases of new cases. Let's break out the cases. Essentially, we have 16 higher ed cases. There's a report, Syracuse had another 10 cases. True, the report was true. So we have 16 higher ed out of our 94. We have 12 cases related to K through 12. So 26 related to education out of our 94. So those are elevated. We haven't seen them that high a little bit. But what's concerning is even if you take those 26 off our 94, we still are left with a boatload of cases. We had 48 declining cases. Now we had a busy day. Wednesdays have been high case days. Over the last month, we've seen this. So out of the cases, we have our unknown community spread. 30 are known. Spread. 20 are household contacts. Positive there. Most of these cases are already back in quarantine. So contact tracing is not as rigorous most of the times. And we know when we have cases, we have household contacts as well. 6 travel-related cases. Looking at that, we have 2 from Connecticut, Missouri, Washington, D.C., international travel. This has been happening. More travel and folks are going out. They're getting sick and coming back into the community. And also we have 2 unknown, and we have 1 senior facility, which looks to be staff, not residents, so that's positive. There's a direct correlation with numbers of active cases and hospitalizations. When your cases go up, your hospitalizations will go up. We have seen this. Today we had 9 new admissions into the hospital and 1 discharge. So 8 new hospitalizations. So right now we have 39 of our residents in the hospital with 6 in the ICU. This will probably be a trend until we get these cases sustainably down to 30 to 50 cases a day. We probably will see people going into the hospital. We'll get discharges because the hospitals have had more success treating the virus, but we're going to get new admissions. And this is a trend that we got to try to stabilize. 39, is this hurting our hospital infrastructure? No, not at the moment. But again, we're getting to a point where we haven't been in a while related to hospitalizations. No new deaths to report on. What are we seeing out of the cases? Again, we're going indoors, and the things we could get away with outside with this virus, we can't inside. We have a cluster of a birthday party. We have clusters related to people going out to eat. We know bars have led to spread. People going to sick and going to work who are sick. That has led to more and more cases, as well as we have clusters at different businesses. Again, we don't talk about the specific businesses unless there's a gap in an investigation about who may have had direct contact. So that this is not a risk to the public to go to a business. We've been releasing those on a daily basis where we've had gaps in the investigation, and we let the public know the time and place where an individual may have been who had COVID or may have been working with COVID. We'll talk more about testing at our briefing tomorrow, but we opened up the F-shed to the public at large. We had over 200 folks yesterday come and take advantage of that. In addition to that, we have our K through 12 appointments scheduled there as well. We ask that you continue to use the F-shed for the testing to the public at large, but if you can go to ongov.net/Cayuga Medical and pre-register, that allows us to do even more testing. Right now, the virus is here. There's going to be more folks who need to get tested. By pre-registering, that allows us to get through and do more testing each day. So again, that's ongov.net/Cayuga Medical. You can pre-register there, and then just come on over and get your test. It's not really an appointment, it's pre-registration, and that will help us get through this. And the key now is we need to really re-engage and really be more cognizant of our own health, re-engage on some of our activities, especially going into the holidays, and just be smart. Get tested, use testing as a way to be with people if you're going to have gatherings. But right now, the virus is in the community again, and we're going to be, if you're in a gathering with 50 people, there's a high probability somebody in that gathering has COVID, whether they know it or not. So that's what the data shows us now. So again, wanted to say, we told you it was going to be a big case day. It is. We're going to have another big case day tomorrow. We don't know the specific numbers yet. Once we start getting them through the contact tracing state system, and sometimes we get faxed in, we have to go through all the cases, make sure there's not duplicates, make sure that these are all county residents and we got the right ones, and then we report out. But needless to say, our health department's going to be very busy with contact tracing and quarantining. And right now we have 1,892 people in quarantine in Onondaga County. It's a lot of people. And we have 557 active cases. And that number is going to just get bigger tomorrow. So we've all been focused. A lot of people have been focused on the election. At this point, what's happening with the election is out of our control. And that's going to be what it is. But what's in our control right now is how we handle ourselves in this pandemic. And we need people getting back in this fight. So I will talk to everybody again tomorrow. And please be safe.